Good morning, everyone. Welcome to Data Day and welcome to ONN. My name is Kathy Taylor and I'm the Executive Director here at ONN. And as folks join us, we're just going to get started because we have a jam-packed agenda and lots of great conversations to have today. So I want to welcome you to our first ever Data Day or Data Half Day and hope we really look forward to your engagement throughout the day. I would like to begin our event by acknowledging that we are meeting on the unceded and unsurrendered land that has been inhabited by Indigenous peoples from time immemorial. Ontario is actually covered by 46 treaties and other agreements, including land purchases by the Crown signed between 1781 and 1930. And we recognize that ONN's work and the work of our network, the work of many of you, takes place on traditional Indigenous territories across Ontario. Today, I'm happy to be at Foundation House, our office here in Toronto, which is Elder Pauline Shirt called Foundation House Sitosikwetsin, which means balancing one another. It is located on the traditional territory of many nations, including the Mississaugas of the Credit, the Haudenosaunee, the Chippewa, and the Wendat peoples. This territory is part of the Dish with One Spoon Wampum Treaty, which was an agreement between the Anishinaabe, Haudenosaunee, and allied nations to peaceably share and care for the resources around the Great Lakes. And it's also covered by the Upper Canada Treaties. We offer our gratitude and solidarity to the Indigenous people who have and continue to protect and defend this land. And although it is important to acknowledge the land, we know it is only one step. So as settlers in the nonprofit sector, it is important that we recognize that colonialism is an economic project and we all are treaty signers and responsible and accountable to Indigenous.
I'm not sure I need to be here, but
I'm
not doing anything else.
Sorry, I think we'll get everyone to mute if you can. That would be awesome. And we know that the impacts of colonialism and white supremacy can be felt, heard within our system and our networks as well. So we look forward to continuing to do this important work as we go forward. So just to ground us in today, I also want to say we have a long history at ONN of working on data-driven decision-making for the sector. We've recognized that data is a tool that nonprofits can use to do their work better, more efficiently and effectively, and more collaboratively. We also realize that there's data governments have, there's data that about the sector. So data has lots of different angles that are of interest to those of us working in the nonprofit sector. In 2015, we started this work with a paper called Towards a Data Strategy for the Nonprofit Sector. And although we had a little blip with COVID, we are now fully thinking about what is a data strategy for the nonprofit sector in Ontario. We had an evaluation project from 2017 to 2019 that looked at shared learning and evaluation outcomes. And it has really set us up to now really strategically think about what data, evidence use, and learning how that can impact nonprofits and charities in Ontario. So in 2021, we launched the DEAL strategy, data, evidence, use, and learning, funded by the Ontario Trillium Foundation and other funders such as City of Toronto, Lawson Foundation, Laidlaw Foundation, and Jumpstart Foundation. And the DEAL strategy is intended to be an opportunity for the sector to adopt good practices in data. First of all, find out about them, adopt good practices in data that are people-centered and rooted right from the beginning in equity, transparency, and accountability that effectively support our working communities, whatever work we do, whether we're arts, social services, sport organizations, or the faith community. We also know that nonprofit data is only one part of the puzzle. Data we have, data about the sector, as I mentioned, data others have. And a strong data strategy must be built by engaging our knowledge holders, our nonprofits, our governments, our academic and research institutions, and our communities. And we also know that we can't do this alone. There is no singular portal, data set, singular data strategy, we must work across our levels of expertise across the country to build an overarching strategy that we can all come and go and participate in along the way. So it's a large sandbox with lots of questions that we would like to work on together. And today is just one of those days in this sandbox. Our deal strategy is working on introducing the nonprofit sector to data terminology, connecting to and between nonprofits and other stakeholders about various data projects, monitoring the data ecosystem, who's doing what, looking at provincial privacy legislation, Statistics Canada products that are relevant for our sector, and sharing our learnings through our e-newsletter. So our goal today for our first data day is to generate some ideas and discussion and delve into examples of what data can do for your organization and for our sector. And we've heard loud and clear, people want practical solutions. They want to see what people are doing. They want to get their heads around, how could I use my data differently? And I think we'll share some really cool examples today of that. And we know, thanks to all of you that filled out the registration survey, that most of your organizations are already leveraging data in many different ways. And that today's participants use data quite frequently and are fairly comfortable with data work. So we also hope to not only to expose you to some tools and help you find partners, we want to learn from you and dig up some ideas and solutions and support your work. And most importantly, we want to build interest and excitement for a data strategy for nonprofits and charities. So we have 2 sessions today. Our first session will feature 5 speakers that will focus on data frameworks, and 3 of our speakers will talk about what organizations are actually doing with their data. And after our panelists have spoken, we'll have some questions from the audience, so please use the chat. After a brief Q&A session, we'll facilitate an interactive Jamboard in breakout groups so folks can talk about how they use data. Then we'll have a short break. Session 2 will focus on different data tools, and we'll give you some time to play around with them and ask our presenters questions on those tools. So a couple of reminders, we still need to do housekeeping stuff, even if we're virtual. If possible, especially for the data tool section, hope you can be in front of a computer. It may be hard to navigate on a cell phone or a mobile device. So just keep that in mind. You're always welcome to use the chat feature to talk to each other or to us, and ONN staff will be monitoring and will be sending questions to our moderator. And if you experience any technical difficulties during the webinar, you can type the issue into the chat box and our team will respond as soon as possible. And finally, to answer our most commonly asked questions, yes, you will receive an email with recording, not the breakout groups, but the presentations and all of the resources that are linked today. The final thing I'll say is today is about learning for everyone, including ourselves. Our planning group has worked really hard to put it together, and at ONN, as many of you who are familiar with us will know, we believe in continuous improvement. So if there are things you would like us to know, please feel free to get in touch and offer your feedback at any point. So at this point, I want to introduce our moderator for the day, Marlon. Marlon is a well-recognized social systems architect with a clear focus on poverty reduction and the social determinants of health and justice within the framework of equity and inclusion. Marlon brings 25 years of experience in leadership positions within health, education, and justice, both within government, the nonprofit sector, and as a consultant with the social innovation sector. Currently, Marlon is Executive Director of Peace Builders Canada and is a board chair for the Toronto Children's Aid Society. He was a previous member of the Data Policy Coalition in Ontario and is currently a steering committee member of the deal strategy that we're currently leading. So I'm going to turn it over to Marlon. Welcome, Marlon, and good morning.
Welcome, and thank you so much, Kathy, for that introduction and for leading us through what folks should expect for today. But first, I'd like to just say good morning to everybody. I know you can't say good morning back, but I believe you are saying back to me good morning. This virtual world that we're in still has a few hiccups that we haven't been able, technology hasn't been able to sort out. So I'd like to welcome everyone today and thank you, first of all, for coming and taking the time out of your busy day on a beautiful Friday to sit with us, to share and to learn. One of the things I would like to first start off by saying is, if you're anything like me, while Kathy was speaking, you probably thought to yourself, what data? what is that? Or you probably thought to yourself, oh, I'm doing that well. I'm going to come here and learn a few things, maybe add a few flavor of what I may know to share with somebody. But one of the things that I know when I joined the coalition and participated on the steering committee, I asked myself one question. I said, Marlon, you have nothing to contribute. You have nothing to contribute. But guess what? When I went and had the conversation, one thing stood out for me. I did have a lot to contribute, and everyone here has something to contribute, and it adds value to the work that we have to do. Data is important. And as Kathy mentioned earlier, in the statement in regards to the land acknowledgement, data is important. When you think of the land acknowledgement and you think of the TRC, data helped to tell a story. Data helps to inform and share what the issues are that are happening in your organizations, in your communities, on the ground, in your frontline services. And data certainly helps in roles of boards, in regards to the boards of directors and organizations, to help make good, sound decisions. But we don't always have the right data. And part of our work is to find some of the gaps, some of the holes, share some of the experiences and knowledge that we may know, so that organizations, and especially an organization like ONN, when they're advocating on our behalf for nonprofit and charity sector, that they have the data, they have the experiences, they have the story to be able to tell. So we look forward today to folks being able to share with us and learn with us. And as I've already said, I'm going to be learning a lot because it is a continual learning process for myself. You folks today have I've seen some of the slide decks and I'm like, wow, okay, I didn't know this, I didn't know that. So you're going to be learning some things because I learned some stuff just going through the slide deck. And I would like to first start off by introducing two very important people from 211 Ontario. I'm going to start by introducing Karen Milligan. Excuse me, Karen, for that. Karen is the Executive Director for 211 Services, coordinating the entire body of 211 Services in Ontario. That's a big piece of work to be doing. Karen is also value-driven and a very empathetic leader who is passionate about working with others to develop solutions to complex community challenges. Sarah Owens is part of the 211 Central East and is a 211 program manager and data analyst with 211 Central East Ontario, and has been working for the organization for over 13 years, which means she brings quite a bit of experience and information to the work that they were doing. So I'm going to invite them to please join us and in their presentation, and we will be taking some short questions and having breakout sessions after. But please, Karen and Sarah, if you don't mind, thank you.
Thank you, Marlon, and hopefully everybody can hear me. We did a little sound check beforehand. I just wanted to introduce myself. So as Marlon said, I'm Karen Milligan, the Executive Director for Ontario 211 Services. I'm coming to you today from beautiful Lanark County in Eastern Ontario, which is the ancestral and unceded territory of the Algonquin people. I want to take a moment just to thank, in particular, Mary and the whole team at ONN, as well as the organizing committee for putting on this event. You know, it's a critical time to be thinking about data in this digital age. So I'm going to share my screen, sorry, momentarily. Okay, so everybody can see my screen now, and I'll move along. I'm going to start out with a quick quote, and this one really struck me this morning as something that was quite relevant to our topic of conversation today. And you know, we've all heard the quote before that information is power. But really, the thing I liked about this is that data and information is a critical resource, but in and of itself is really only useful if it's shared and if it leads to some sort of action. So I'm going to talk a little bit, just for those of you who may not be familiar with us, about what is 211. And really 211, we're in the information business. So you know, when we talk about data, it really is at the core of everything that we do. So very briefly, 211 is a 3-digit number to access services. And for people in Ontario across the province, it's available 24/7, 365 days a year by phone, live chat, text, email, and through an online search at 211ontario.ca. So the services are available and are delivered by accredited information and referral organizations across the province in compliance with a North American standard around information and referral delivered by AIRS, which is the accreditation body. And really, I mean, the mission for 211 is to increase access to services by providing people with the information that they need in order to understand what services are available and which ones they are eligible for and how they can access them. Really, 211 breaks down into 3 core functions. And the first one most people will be familiar with. It is system navigation, which is a bit of a buzzword these days, especially in the healthcare sector. But really what it comes down to is helping people access services and understand the service ecosystem. We do that, as I say, through a variety of live channels as well as online self-serve channels. The second area is around data and systems mapping. So I'll talk a little bit about the kind of information and data that 211 collects and how that is used by others in terms of understanding the supply of service, but also the demand for services across the province. And then the third piece is really around system design. So how to the quote we talked about earlier, how do we use that information in order to ensure that people can access services and therefore improve well-being? And also as a system, how can we use that information to better inform service design? So the types of data that 211 collects are varied, but as I say before, the backbone of our service, of our navigation service, is a resource database, which includes over 60,000 programs and services across the province. I mentioned the data adheres to North American AIRS standards, which my colleagues know much more about, so I won't get into the details of it, but all to say it's highly standardized, allowing for integration with other data sets and platforms. And certainly, you know, again, there are multiple data sources in terms of the information that 211 makes available through those channels. And some of those are regional service partners, some of them are local data partners across the province who feed into that provincial data repository. On the flip side, there's the contact data, and this really is, excuse me, where, you know, through the interactions, through the contacts to 211, we are collecting information about where the person is calling from, what their need is, what exactly, a little bit of demographic information about those callers. And typically that information is being collected in order to provide an accurate referral. But at an aggregate level, that data can inform, certainly, you know, give decision makers and policymakers an understanding of where the needs are, and in particular, where the service gaps might be. We believe in data sharing. You know, we have a principle that our data is open by default. So there's multiple ways that we share both our resource and that contact data around what people's needs are. Excuse me, and you'll hear more from one of my colleagues later in, I believe, in the second session with a very detailed overview of the types of information available through that public dashboard. But we also connect other organizations with our resource data to enable them to provide sector-specific or issue-specific information through their own channels. So I'll talk again, a little bit about the types of people that we are currently sharing the resource data with, but we've enabled that kind of data sharing in order that that information does not need to be duplicated, the collection of that information across multiple sectors. And then, of course, we share some of that contact data for research purposes. In terms of care coordination, which my colleague Sarah will talk a little bit more about in a moment. So this is just a very quick slide to give examples of the types of people that we are partnering with around sharing data, enabling different platforms or search tools within different sectors. And of course, we are partnering very closely with United Ways across the country in order to bring the 2-in-1 data to life and also integrate it with other data sources to paint a clearer picture of what's happening in communities. So, what I wanted to talk about a little bit is just how 2-in-1 is looking at data and how it is actually informing our future state business model that we are moving towards. So, a few years ago, pre-pandemic, we came together as a network, 2-in-1 network, to talk about what our ultimate vision is in terms of increasing our impact. And we talked about, you can see on this slide, sort of the ultimate outcomes that we are striving for. But it became clear that, again, some of the intermediate outcomes or ultimate outcomes really required us to understand our data, but also to ensure that the data is providing the greatest value to those who need assistance. So I won't talk in too much detail about this slide, but all to say we've gone through an extensive process of evaluating our business model for 2-in-1 across the province. And you can see that in this future state model, the information and referral work that we do is obviously the cornerstone. But some of the work that we see emerging is where we can use that data again to really inform both research and service design in the future. One of the elements of that future state business model is something called the Community Information Exchange. And again, my colleague Sarah will talk about that a little bit further in a few moments. So I just, at a very high level and from sort of a senior management perspective, the idea around the use of 2-in-1 data and technology is about delivering better value and better information. So really looking at the data in combination with the tech tools that we can apply in order to provide tools that aid in the provision of our service, but also aid others in navigating the system. Tools that provide data insights and certainly tools that sort of at a system level can improve things like community care planning. And again, access to information is certainly key in improving somebody's well-being and enabling them to manage their own care. I'm going to slide through to this last slide, which really is in terms of how data and tech are informing our future work. I think these are some of the key ways that we will be focusing on increasing standardization of our data in order to ensure that we can share and integrate our data with other data sets and paint even a clearer picture of what's happening at a community level. And also, again, we want to definitely do more as far as identifying where we can use, in particular, information about service gaps to advocate for increased services or different services in certain areas based on areas of unmet need. So I'm going to hand over to my colleague, Sarah, who's going to talk a little bit further about just some of the ways that they've taken data sharing even further in terms of the CIE model. So over to you, Sarah.
Hi, everybody. My name is Sarah Owens, and I work with Community Connection in Collingwood, Ontario. As Karen mentioned, we are one of 6 regional service providers for the 211 system in Ontario. And today I'd like to talk to you about a pretty neat initiative that we're working on here locally. Okay, so it is closed loop healthcare referrals. It's one example of enhanced data collection and sharing for the public good. So in 2015, we partnered with 211 Ontario was identified as a key resource for the Ontario College of Physicians and Surgeons, specifically the Poverty and Health Committee and the Center for Effective Practice, developing the screening tool. The tool for primary care providers directs providers to use key questions to assess their patients living in situations and living in poverty. So that was sort of the goal, to do a poverty screen with patients, to connect them with community resources and address those social determinants of health. So when we started working with that group, initially they were thinking that the primary care physicians would be the ones to do that information and referral with clients, not with clients, with their patients. And it quickly became apparent that that would not work. The landscape of social services is too complex, and doctors don't have the time to do such things. So we decided to develop this closed loop process where physicians would be sending referrals to us. One second here. So this is the process that we are using locally. So it starts with number 1 here, where the clinician asks a few questions with their patient to identify any risk and need. It began with screeners for poverty, asking people questions like, do you have any trouble paying all of your bills at the end of the month? And have you completed your taxes? And those are 2 questions that if the answer was yes, that was a positive poverty screen. It has expanded further to include more social determinants of health. So if people need access to assistive devices or any other community supports, they can be sent via electronic referral, which is a fax, electronic fax, to our local 211 contact center. We receive that fax and we initiate an outbound call to the patient where we do an in-depth needs assessment. We offer advocacy, empowerment, information, and community referrals. All of the people that are referred to us from the healthcare system are offered follow-up. And if they accept that follow-up, then we call them back in the few weeks in the future to determine how they were doing. Did they follow through with the referrals? Were their needs met or not? And we can provide some empowerment and support to individuals so that they can meet their goals. Then at that point, we create an outcome report for each patient and submit it back to the referring clinician. So that's sort of the closed loop part, getting that data back to the physician. And the physician will scan the outcome report into the patient's EMR. So that is recorded and can be reviewed at the next visit. So currently in 2021, we've received over 1,224 referrals from community health organizations. We have 2 countywide paramedic programs partnering with us, 10 family health teams, and 3 hospitals. The paramedic team in Simcoe County was actually able to monitor patient data and conclude that we were the participation in this program reduced repeat calls to their 911 system by 28%. And although the current system is providing a lot of value for the patients and the doctors, it still has some challenges for us to resolve. The traditional process of information and referral in Ontario means that the patient is carrying the weight of the next steps and access. It's not trauma informed because clients must repeat their situation to the next people that they're interacting with. So if we refer them to the Red Cross or to another community organization, we're not sending our notes. They have to repeat their situation at every door they encounter. It's also relies solely on the client to self-report, and in our experience, people in crisis may not be good historians. And our community navigators as well don't see any background information on when these people have called us before and how we've helped them in the past. In addition, our inbound contact center technology really, it kind of limits us in terms of our ability to effectively structure detailed case reports and to schedule the high volume of outbound calls that this requires. In addition, it's just lots of copy and paste work for us. And all of that sort of limits our ability to scale this up, which is what we would like to do. So all of these challenges set our organization on a digital transformation journey, which has evolved into a pilot project with the South Georgian Bay, Ontario Health Team to implement a community information exchange model locally. In 2019, we partnered with a digital innovation solutions company to build a technology platform to improve our data collection, reporting, and to streamline the workflow so that we could have more time and capacity to expand this to more partners. Over time, with multiple funding opportunities and learning everything that we could from our colleagues at 211 San Diego, we set our sights on launching a community information exchange. So 211 in San Diego, they had developed this community information exchange model, and they have been using it successfully for a few years. So the CIE is basically just a tool that allows coordination across a network of people. And as part of that network, we are developing various digital components that enable cross-sectional data sharing and a longitudinal record. So what exactly is a CIE? It's really, at its essence, it is simply a tool that that enables care coordination and brings together existing networks. We're more familiar with it, I would imagine, in the health realm. So a health information exchange would be how we understand our primary care physicians share data with specialists at the patient level. And so the CIE is basically expanding to include community information service providers into that health sphere to enable us to share data more easily and automate all of that work that we're doing. And really, it's a response to the social determinants of health, so that healthcare providers, case managers, and anybody else that is involved in caring for a patient or an individual has access to all the information and available communities resources, what resources someone has accessed, and can help follow up on referrals to improve the care planning and addressing those social determinants of health with individuals. So next, I'm going to talk about 3 of the components that additional data elements that we are adding to the CIE. So this goes above and beyond traditional 211 data collection. We find very interesting. So the first additional layer of data that we're adding is a new longitudinal contact report for the 211 system. So this means that the new contact report, we're building a new contact report, and it will be accessing all of our existing tools. So it's integrated with our call recording technology, with our database technology, and it serves data back to the provincial BI system. So everything is integrated into one new system. It streamlines technology workflows in the 211 contact center, and it supports tools that allow nimble data collection and outcome reporting. And it creates a longitudinal record for the patient. As I was saying before, this new tool will allow us to see historical interactions with the clients that agree to participating in this historical data collection, the longitudinal. And it enables the integration of information and referral data into the digital platform of the CIE network. The next thing is the Common Assessment and Risk Rating Scale, which I think is the most exciting component of the additional data elements that we're building. So again, this one was developed in the United States by 211 San Diego. And it has 14 different domains of health and wellness. And under each of these domains are a series of questions, standardized questions, that we can ask when we're interacting with an individual that's called 211. And it asks questions that are aimed at assessing their risk in each of these domains. So right here we have an example of one housing and home safety question. So what is your current living situation? And depending on their answers, that will sort of group them into either in crisis. So if they're homeless, utilizing emergency shelter, or fleeing intimate partner violence, then they're immediately identified as in crisis. What's pretty interesting, I think, cool about this is it's also connected to our resource database. So if somebody's flagged as being in crisis in terms of housing, that will initiate a targeted search of our resources that are specifically tailored to support people in a housing crisis. So all of this can help our community navigators at 211 to best serve people in our communities. And it also will record where they are on the scale.
Sarah, sorry, I don't mean to interrupt you, but we are a little bit over time. If you can maybe go to wrap up or summary slides.
Okay. I'll just speak to this one really quickly. There's also a CIE longitudinal record for care planning. So basically, every person in the CIE who is a partner collects their own data and shares it into the CIE, and it's saved in Microsoft Azure's cloud system. And depending on individual users' access, that determines what data they can see. And here's the risk domains. So that, in conjunction with the longitudinal record, allows us to, I don't want to miss this, track a person's improvement over time. So we can see if we're able to move people along the scale from housing crisis to housing stability, from food insecurity to food security, all with the goal of improving health, wellness for individuals and populations through a holistic health equity focus. And I'll leave it there. If you have any more questions about our specific community information exchange model, contact Pam Hillier. She's the executive director of my local organization and the health initiatives lead for Ontario 211.
Awesome. Excuse me, folks. Awesome. Thank you so much, Sarah and Karen, for that. Like I said to folks, I learned a few things prior to seeing the slides, and I've learned a few things again. So it's just some continual learning here. What I just wanted to remind folks that if we will have a time for folks to be able to ask questions, and I'm hoping that there are some, because I may have a few questions for our presenters. Before I bring in the next presenter, I just want to what we see is happening right now. One of the impacts of COVID, not only has it impacted a number of groups who are already vulnerable, but it's also created a migration. interprovincial migration, rural to city to rural migration, migrations from cities to cities, and that has an impact. And one of the things that I thought of as you folks were presenting was, wow, is there a way, how does that impact what happens in across cities over the last few years? And is there a way to track that and understand that and plan for that? Because we're told there's going to be other types of situations like that. So I find the work that you folks are doing fascinating and looking forward to learning more in regards to the question. One of the pieces I believe I saw it in the chat, one of the pieces that really struck out for me was you're able to track individuals from saying being previously homeless to home stability. And I'm like, can I get that as a parent so I could track how I'm doing as a parent with my children? I don't know. Just a thought, maybe not appropriate, but that would be a helpful tool for me as it relates to data, to understanding where I am doing or how I'm doing with my kids. And they're not on this call, so I could use them as examples. So thank you, Karen and Sarah, for that. And as we talk about migration and city and rural and counties and et cetera, I love this name. Big data for small communities. From the Rural Ontario Institute Initiative, and I'm going to be bringing forward to you folks Nelson Rogers, Community Ingenuity. I love that name also. Nelson Rogers is a founder and principal consultant at Community Ingenuity. Is a research and a consultant in areas related to community development, program review, strategic planning, and post-secondary education, not to mention a whole bunch of other amazing things. So remember, think about the presentation, think about questions you may have or solutions you may have or answers to some of the conversations that's happening, and put them in the chat. And when we get to the conversation piece, we will get there. So I bring forward to you Nelson Rogers, Community Ingenuity. Big data, small places. That's what I should have been saying, right, Nelson?
Yeah.
Thank
Yes.
you.
Yeah.
There you go. Love that name too.
Yeah. Okay. 1 second here, and we'll be good to go. Yeah, it's an honor and a privilege to be in this group today with some fellow travelers who are working on turning data into understanding and understanding into action. And I've been working in rural community development research and consulting for quite a while, and largely with rural community colleges in a previous career, and more with rural municipalities in the last decade or so. And what I heard when I talked to rural municipality staff and nonprofit organizations in rural contexts, the questions they were asking had a lot to do with data. So when I would start working on a project that might be on communication infrastructure or transportation infrastructure, and the questions that the staff were asking had to do with data. And these 5 bullets really highlight the main things that I heard over and over again. About tremendous access to data, but so many different varieties of sources and formats. Really quite a landscape of data to navigate. The last time I checked, OMAFRA has 275 open data products on their statistics website, and some of those products are massive spreadsheets. The second thing I heard was increasing requirements to use data, and pressure on staff to make more use of data in grant applications and progress reports, or municipal staff reports to council, or NGO staff reports to boards. More and more pressure on better use of data, better increases in productivity, more efficient organizational operation. And at the same time, the staff were faced with really limited in-house resources for data access and analysis. You know, it's a specialized field, data access and analysis, and I just haven't found municipalities under about 75,000 population that really have the budget to afford in-house data analytics expertise. And most of the municipalities that I'm working with are communities of under 10,000. So there's a big gap there in capacity. And the consequences were lots of missed opportunities where groups were unable to apply for grants or to use the grants effectively. Some poor decisions that were not data based and went off on tangents. I can consider criticize the consulting industry because I'm a professional consultant, but really a lot of money wasted by small organizations on ineffective consultants who come in and run numbers that don't really understand the local context or how to make sense of the numbers in the local context. So the people were turning to me and asking me what can be done about this, and this didn't come out of nowhere. It came out of a long period of consultation with a variety of groups, and it evolved into the Big Data for Small Places program. This is a capacity building experiential learning program. It's not a course. So it's groups come together with a particular project or problem or opportunity. We work through a process of mentoring, training, and networking. It's not instruction like a conventional course specifically, because people working in rural communities have a lot of capacity. They have a lot of things that they know about their community, a lot of things that they know how to do. And it's through this experiential learning approach, it helps people use their existing knowledge and build on it. It's designed to help integrate various bodies of knowledge. So we try to build working groups that have multiple perspectives on a community issue or a community opportunity. And we try and make sure that around the table, there are people who are knowledgeable of economic, social, cultural, and environmental issues, not siloed into one specific approach to a community.
Oh my goodness.
And the ultimate goal is to improve data literacy and data utilization capacity. So we deal with a few key questions that people bring to the table, and every edition of this program is slightly different because it's built on what the working groups need. So people come with issues around making the world a better place that are, political and philosophical issues and not really amenable to data. So we need to scope down. Data is the answer to a lot of things, but data is not the answer to everything. And then one module in the program is about community needs, and we use a format of 5 approaches to understanding community needs, and this was adapted from a system that's been used in public health education in the UK for quite a while. So this didn't come out of nowhere, but depending on the type of need, you may want to look at what's the expert opinion on what the community needs, or what is the community asking for. That's 211 data is very helpful in what is the community asking for. Or if you go out to the community and survey them, what kind of responses do you get? And comparison is often a factor in understanding community needs. So the provincial or national average of a certain type of service or certain level of indicator of well-being, and then compare how your community fits that average, can give you some insight into need. So 5 approaches to understanding community need. And then what data do you need to understand that in more detail? How do you turn that into useful information so it can be communicated to people who need to know it? We have a module about indicators, and this was adapted from work that's been done at Aspen Institute some time ago about community indicators and how to select indicators or develop indicators to look at aspects of community development and community well-being. And yeah, and the last bullet there is about communication of data-related findings. We have some interesting tips and techniques for communicating to specific audiences. So through tremendous support that we got from Rural Ontario Institute, from OMAFRA, from Ontario Ministry of Municipal Affairs and Housing, and from the Federal Center for Rural Economic Development, we had a lot of partners put money or technical resources into the evolution of this, and we've produced a workbook that found here. Okay. Can you hear me now?
Yes, we can. Thank you, Nelson. Please continue.
Okay, thanks. So we have a do-it-yourself workbook that goes through the program about the pre-program consultations, formations of working groups, and getting some agreement on who wants to come together to work on this. Then we generally run it a module per week in person. Sometimes we do 2 modules in a day. A module takes 3 hours or so. It depends on the group. We've done some of these with Zoom webinars, not promoting Zoom in particular, but any online technology could work. Each module has a worksheet for the working group to examine key questions and with the suggestions for moving along. And there's quite a bit of work that the working groups do between the facilitated sessions to make progress on their particular project. And normally the final product is some kind of a document, a policy, a program proposal, program evaluation, a grant application, or something with the data to support it. Okay. My screen is frozen here. There we go. So this is the process map of how the process works, and you'll see the circles in the process map that sometimes you start out with understanding a certain understanding of a need, for example, and then after you find more information, you need to cycle back and re-look at the need and look at it again. So some of this is an iterative process. The networking is a key component of this, and we find the groups build networks among themselves and between various working groups and associations. I'll give some examples of that in a second. And the end result has to be a plan for action. This is not an academic exercise just to generate a bunch of numbers, but it's to produce some evidence-based action plans. So in our follow-up, the benefits that people reported to us was the networking was a huge benefit, and building networks to who has data and who has analysis of data that's relevant to a local community issue or opportunity. We found big improvements in data literacy, just familiarity with data concepts and terminology. Big improvements in productivity, where the staff were able to use their time much more efficiently in finding and using data, and a big decrease in the need for external consultants and expensive external resources to deal with common data issues that small groups and municipalities and nonprofits work with. What we found in our follow-up is what makes an effective working group, and this is not just about big data for small places, it's about a lot of community development initiatives. That there's 3 key roles in making a successful group, and that is a champion, the face and voice of the project, someone who's really going to carry it forward in a public face, a researcher or team of researchers, and some small communities, they often found that the local librarian was delighted to be asked to be involved in a community development or community opportunity working group. And so in some cases, the researcher is a grad student who's getting work experience in this, but you really need somebody who's willing and able to spend some time on the research. And then you need a subject matter expert. If you're dealing with housing, you need somebody who knows housing. And if you don't have those three roles, your group really struggles. And shared roles, it's also often key that some in each of these roles, if there's 2 or 3 people that share those each role, it makes a huge difference in the success of the project overall. So some examples of how this has been used. We worked with the municipality on studying active transportation, and eventually they went for official designation as a cycle-friendly community. And getting that designation is quite a data-intensive task, but the understanding active transportation and the benefits to the community is also quite a data-driven task. We worked with a group on managing parks and recreation. This was a urban adjacent small community, and they found that every time a subdivision opened, somebody came into the town hall and said, you know what this town needs? And they had some difficulty managing what the parks and recreation expectations were. And we helped them work with the Parks and Recreations Ontario that has a research branch, and was very, very helpful to share data and how to understand local demand and how to manage demand for parks and recreation. And they found through the Big Data for Small Places program, they were able to cut their consultant budget in half because of their increased internal skills and their access to data networks that were dealing with similar issues. So we worked with welcoming communities. This was attracting and retaining immigrants in small rural communities. We looked at the impacts of school closures, closure of rural schools, the value of trails. How do you determine to what extent a community should invest in trails compared to what results you might expect from improved trail infrastructure? And rural transportation, communal services is a really neat one. Providing shared water and wastewater services in villages that have no municipal infrastructure of any kind. So a lot of different kinds of topics have been brought to the table on this, and the Big Data for Small Places approach is flexible and driven by the working groups so that they can use data to deal with whatever the local situation is. Currently, the second edition of the workbook, and we had some really good support from Center for Rural Economic Development to produce the second edition, and that included being able to hire a professional instructional designer to adapt the workbook so that it's useful not only for in-person face-to-face work, but also for online. And this workbook's available free from Rural Ontario Institute. You can go to the website and download a free copy of the workbook. We also have a facilitator's guide for people who would like to lead Big Data for Small Places working groups, and that's available by request. And again, Senred paid for the development, and I'm really interested in identifying and mentoring facilitators. And this is the vision of Big Data for Small Places is to put the data expertise in the hands of the communities. And I think that a few key facilitators could really move that forward. And I'd like to be, a coach of facilitators and not have this program revolve around me necessarily. And then we've had requests about adapting the big data for small places approach to other contexts. So for examining neighborhoods in urban communities, for dealing with specific problems in other provinces, for example, working with Newfoundland and Labrador on communities that are declining and reducing in population, reducing in services, and a different context than a lot of other rural situations. We've also had some requests from Ireland and from Kenya about developing versions of this program for them. That got kind of sidelined by COVID, but that may come back on the table. So we see lots of opportunities to move this ahead, and glad to have this opportunity to talk a little bit about it to a group that may have some interest in picking this up and making it work for whatever situation you're in. So thank you.
Awesome. Thank you so much, Nelson, for that. And there are some questions in the chat in regards to getting some more information that we're sharing with folks now. And thank you for that. A couple things that you shared that was very interesting to me. The experiential learning and capacity building, which I think is important in the work that we do, especially across a diverse province like Ontario. And I'm just thinking of small to medium-sized agencies like the one I'm a part of that sometimes are doing this at the side of their desk or at the moment of writing a grant proposal, and how important it is to be able to make the rationale, provide the data, etc. So I think there's a lot of great opportunities there. And one thing that struck me in what you said was around reducing dependencies. I think many organizations, we strive that for the young people, families, or whoever our target group is, working with them so they reduce the dependencies on us and have that capacity for themselves. And I see that mirrored here in your approach. So thank you for that. And we're looking forward to some questions that may come later for you. Thank you. Next on our agenda and on our list, a couple of folks that I have had the pleasure of working with before, at least one of them, from the City of Toronto, and they're going to be partners on in regards to data equity. Guillaume Machimenko is working with the City Data Manager Office and is the lead for the City of Toronto first ever, believe this or not, the City of Toronto's first ever Data for Equity strategy, which I'm sure the City of Toronto so desperately needs, seeing that diversity is the strength, is the motto of the city. So we look forward to hearing from Guillaume. And also Kasal Kai. Kasal and I have gone back together for many years, so it's so amazing to be able to see you here today, Kasal, and looking forward to what you have to present. And Kasal is the Director of Strategic Partnership and Opportunities Development at Find Help 211 Central. And over the years of work with, oh my goodness, grants development, management, evaluation, all within the nonprofit sector. So I bring to you today Kasal and Hayom from the City of Toronto and 211 Find Help.
Thank you so much, Marlon. We're going to just start sharing our screen shortly.
Can you guys see it?
Yes, we can see it. Could you just make it full screen? Thank you, Kasal.
Full screen. There you go.
Perfect. Thank you. Hello, everyone. Thank you so much for the opportunity to be here with you on this Friday morning and to share the City of Toronto's Data for Equity strategy. My name is Hane Matsumeiko. My pronouns are she and her, and I lead the city's Data for Equity unit. I am joined today by my colleague Kasal Key from Find Help 211 Central, who will also take you through one of the city's Data for Equity pilots, which is a really great example of how data is applied in practice, in practical terms within the social services sector to better serve our communities. So I understand that the concept of data equity is quite new for some of us here, and I'd like to start us off with some context on data equity, but more from a perspective of a municipal government, the City of Toronto. In 2020, the city developed the data for equity strategy so that it's really possible to understand who is accessing city services, programs, and who is achieving what outcomes and encountering any potential service barriers. We do know that inequity still exists in our city, and that not all Torontonians and service users have the same access to health, well-being, inclusion, and participation. So the data for equity strategy is just one of the many ways that we strive to address this inequities at the city. And in simple terms, the purpose of the strategy is to guide city divisions and partners such as yourself in the social sector on the best practices to collect and use social demographic data to make better evidence-informed decisions and provide equitable services that will ultimately respond to the needs of Toronto's diverse population. Next slide, please. This strategy also provides a framework and guideline for organizations on how they can collect and use data in ethical and equitable ways to really achieve one of the three broad big objectives. The first being to understand the experiences, the barriers, the outcomes of our residents, to translate this data into meaningful action, not to just collect it for the sake of it, but to really be intentional about co-designing solutions, primarily with communities that we know are most impacted by the service deliveries, and to ensure that our services, our policy, or even funding models are ultimately going to have an equity consideration and respond to the needs of our communities. And lastly, we also use this data to monitor and measure if any of the interventions or the actions that we're putting in place are moving the dial and making any meaningful progress towards a more equitable city, making social change, and certainly improving the outcomes of our residents for the better. So the main focus of this work is public facing. So we're really interested in understanding the social demographic characteristics of residents, program participants, and service users. We're really focused on taking an intersectional lens to understanding who people are and their social identity. That is the Indigenous, racial, age, ability, sexual orientation, or gender identities, and these are just examples. We are also interested in learning about where people live across the city and their different housing circumstances, as well as what people achieve in terms of the income, education, and employment levels. Again, these are just examples of some of the data elements that we typically focus on in our data research to better understand who we serve, their experiences, and what opportunities we can put forward to better serve them in the future. I also just want to quickly highlight that this type of social demographic data collection is voluntary, except where it's required as part of program eligibility. So our residents and service users are well within their right to refuse to provide any personal information that they're not comfortable sharing, and it would not negatively impact their access to services at the city. So we've been on this journey for a couple of years, and as I mentioned, the data equity strategy was adopted by the city in 2020. It also includes a set of guiding principles and guidelines for organizations to follow on why, when, and how to collect and manage social demographic data in an ethical and consistent manner. I'm happy to share some of the documents so for your review later on in terms of the detailed strategy and the guidelines. But I just wanted to quickly highlight some of the guiding principles and best practices for your consideration as you think about your next data equity project and how you could also ensure that this work is done in ways that ultimately is going to serve the communities best. At the forefront, the core critical guiding principle that we encourage all our clients to really focus on when they're thinking about the collection and use of data is really centered around equity, inclusion, and human rights. At the very end of the day, our ultimate goal is to be able to use data to inform services and operations that will create and sustain equity, inclusion, accessibility, and respond to the needs of our Indigenous, Black, and equity seeking communities across our city. Privacy and security is also quite central. So the collection and use of data should be conducted in a way that protects both the individual privacy of our clients, but also considers the community privacy and how this data could potentially be used to continue to perpetuate stereotypes or stigmatize groups of people. Community privacy is often something that we don't talk enough about. We, for the most part, understand the importance of privacy and security from a legislative perspective, but I also wanted to offer that consideration for you to also think about how will this data really impact the folks that you're serving. And certainly one of the consistent feedback we hear related to open data is that oftentimes government or organizations in general are really great at doing research and collecting data, but they don't share back what they have learned or heard through the data from the folks that they're collecting this data from. So open data is one of the guiding principles that we have in our data equity strategy to really foster that accountability and transparency about the work we're doing. So when it's appropriate, anonymized aggregate data sets could be made public in a timely fashion to facilitate sector-wide evidence-informed decision-making that will really ultimately benefit everyone, including those that are providing the data. Given that a lot of our work is heavily focused on serving communities, it's also critical to ensure that the processes to collect and use socio-demographic data consider Indigenous and Black community data governance and methods of engagement with these communities. This is really one of the central pieces too of the work that we do at the City of Toronto, and we certainly encourage all our clients and partners, including the social sector, to think about ways that you can consider and address the principles of Indigenous data governance and methods of First Nations, Inuit, and Métis engagement and guidance on how their data should be collected, protected, used, and shared. And certainly as well, consider how you could collaborate and engage with Black communities, experts, organizations to ensure that their data supports positive community outcomes and does not stigmatize, harm, and negatively impact Black communities. So these are just some of the guiding principles that we have. And as I said, I'd be happy to provide you with more of the strategy and guidelines through the event organizers. The City of Toronto at this time is focused heavily on implementing a series of pilot projects as an opportunity to test and learn from how the guidelines and the strategy works in real life. And so we're focused on looking at this work in different city and service contexts, from public health, children's services, employment, and social services, as well as community funding. Today, I'd like to introduce one of the data for equity pilots that we're working on, which is related to this community social services sector. And this work is currently ongoing in partnership with Find Help and 211 Central. Kasal is here, who will walk you through where we are in our journey with this pilot. So Kasal, I'll pass the virtual mic to you to take over from here.
Thank you, Hone, and thank you everyone for having us. Marlon, always good to hear you and see you, even if it's virtually. It's been one of those years, right, that we're all seeing each other online. Hone, thank you so much for introducing us as one of the pilot projects for the City of Toronto. Let me just move the slide here. Next button is gone. Here we go. So as well as Hone had mentioned, we are the pilot project on behalf of for the community social services sector, and a pilot that looks at some of the challenges as a sector that we have in collecting data in our own agencies, our programs, and our services that we deliver. And we know we are, as Marlon had said, doing this on the side of our desks. We are doing this individually, depending on the sector that we serve, the neighborhood, or the vulnerable population that we serve. And I think there has been a need in our sector that we need a tool that works for all of us, that we can all centrally use and begin to start building our own capacity development as to how we standardize the tool, how we use the tool, and how we speak about data as a community social services sector. So this pilot looks at building the capacity of collecting social demographic data across the non-for-profit sector. You're doing it in a way that is trauma-informed for folks who are being asked the questions of how sensitive questions, and also how to do it in a way for our service providers and users so that they can be asked in a sensitive way. We understand by collecting social identity data that we are looking at the intersectional approach of social identity and begin to understand more about how various identities overlink and connect with each other. And of course, the goal of the project is to also begin to collect an evidence-informed approach in our decision-making as a community social services sector. When we speak in this pilot about some of the social identity data collection points that we're looking to collect, this is an example of what the tool will collect. So various examples here, and for the purposes of time, it's just on the slide. Just as a background to how this project came about, in 2019, pre-COVID, the City of Toronto, United Way, Greater Toronto, and the Toronto Central LIN came together working with 12 not-for-profits to start hammering out this complex problem of how do we begin to centralize and to think about data as a community social services sector, working with a tool that the City of Toronto had alongside adapting it from Toronto's public health tool. We've been able to have a survey that allows us to just test drive the tool. As a community social services of partnering with 211, we looked at it and took a tool again in 2020 and tested against our national partners in 211 specific services. And then now in 2022, we're back at with the tool again for the community social services with different partners at the table. But equally important, 211 is now partnering with Ontario Trillium Foundation, the City of Toronto, United Way, Greater Toronto, on a second pilot, again, to try to test the tool and to see if we can kind of scale it to more agencies beyond the 12 first agencies that use the pilot project. Just wanted to pause and just to share with folks on the call, because I know many of you are data folks and would love to just understand some of the key learnings on our first rounds of the first pilot at a smaller scale and at a national scale. We understand the folks and organizations that are going to be doing a project of this nature. It also is an underpinning of the practice of the organization. And our key learning is organizations taking the time to also looking at their own practices, having their own statements and equity statements and foundational policies and principles and frameworks within their organization before even moving ahead and collecting data. So that's just a key learning that many organizations have echoed in our first iterations of the pilot. The pilot, of course, highlights the equity work and the need to talk across the systems and highlighting the need to do the equity work, as we have all found during COVID, how important that work needs to be. Organizing and prioritizing the core mission and making sure there's alignment across the sector when we're doing this work as well. Again, iterated and the importance of when frontline staff are asking the questions of importance of how it is that we are asking it in a culturally specific way, a culturally sensitive way, and that we are not doing harm in asking the questions, but being really thoughtful and designing it in a meaningful way. Developing standardization across the sector is a core goal, and it's been iterated as a key learning that as we develop the principles, but also developing the standardization of how we approach the work, how we look at the work, and how we then use it across the sector. And of course, the last two are just around how we collect the tool and the importance of the standardization of the tool. So as a tool, as any other tool that's in the sector, it's never perfect, it's iterative, but starting to use best practices across the sector so that we're all speaking from one tool when we're speaking to public policy holders or funders or just our own partners, and how we tell the stories of our populations that we serve using a standardized tool that we're all using the same language and consistency across our sector. And of course, our two pilots have demonstrated just the importance of the continual learning and continuing investment in a pilot such as this, so that we can continue to understand and work as a sector to have that collective impact that we all desire to have. So the Be Yourself initiative is a second round of iteration at the local level here in Toronto The goal of this initiative is to, again, just collect best practices on collecting the tool and the use of the tool and socializing the tool in the non-profit sector. The goal this time, again, is to scale it a little bit more than just 12 agencies and hopefully call upon 50 to 70 agencies in the sector to start to work with us and to use and test the tool with us. We are working to look to develop the sector and to also develop the collective process on how to use it. We will provide support in the project. It's a very much a capacity building project where we'll look to also evaluate and report out on the outcomes and not keep it insular, but rather share it with the sector. As our learnings evolve, we will of course share it, and then of course develop recommendations for the sector and have future iterations as we think of scalability in the future. Who's involved in this? We as 211 Find Help Central is the core host of the project, as we see ourselves as an intermediary in the sector of many of our partnerships and relationships that people provide data into our resource data that we're looking to tap back out into our agency partners to join us on this journey. We have sought the consultants of the capacity building project to have folks who are, we all count, and in D&D inclusion are our partners on this project to support agencies who choose to join on, to participate and learn from our data science partners on this, and also have a developmental evaluation alongside our learnings so that we're collecting learnings along the way for our partners. And equally as important, we have our funders alongside us throughout the whole journey, both from an advisory, from a developmental learning, and from all the supports that one could want. They are here and they are right there listed as well. Toronto, OTF, and United Way. So really, I hope, as you hear this and as the whole day for you unfolds, is to think about your role in data collection and how your organization can be involved. And if you're interested, just to consider joining our project. We'll promise you it's a supportive environment of peer learners. It's going to be friendly. It's going to be user friendly. There will be tools, resources, and a playbook on how to do this. All of the key considerations, organizations, big, small, grassroots, charitable, non-charitable, all of those folks that are in this group, we can also just wanting you to invite you into this project. It's a capacity building project on how to use the tool. It's a capacity building project on how to work and build a whole community around data collection. The tool itself is it's something that will teach you and will show you and provide you and leadership and management and frontline staff on how to use it and all of the considerations around it. And it's just, hopefully you guys will, folks who are listening today will consider joining. If you are interested in learning more, because I know time is limited today, is that there is a website, beyourself.ca. You can find more information there. And if you'd like to hear a little bit more and speak directly to me, that's my contact number. So thank you so much for your time.
Awesome. I must say, Kasal, I'm a fan. You know we're under stress of time, and you did that so efficiently and effectively. And thank you also for doing that. So thank you both for that, folks. There's a couple things that has happened in this first half of this presentation. And one word comes to my mind. A couple words. I'm a man of words. There's a bunch of opportunities here. We've heard from big data, small spaces, an opportunity there. We've heard from Kasal in regards to opportunities with what they're doing, the pilot project that they're there, and they've already put the challenge out for folks to join them around building the capacity, their internal capacity of their organization, and building the capacity of our most useful resources, the staff who work with and for people who are facing numerous challenges in our community, cities, and province. So look for those. This is going to be a time where I'm going to be, if there's any questions from folks, please share them in the chat. I do believe there is a question. Let me just find it. I should know this right away, but with technology. Okay, here it is. And then the question is for Dr. Rogers on who could, this comes from Simone, who could I reach out to ask about the past project of attracting immigrants to programming? Simone is working on a pilot project with LGBTQ to spirited newcomers and refugees in the Niagara region, and we've never had a program like this in our region, so data is very scarce. What would you say to that, Nelson, please?
Yes, the project that we worked with was about attracting and retaining immigrants in small rural communities. So it was had a lot to do with the welcoming community concept, and I could probably the best way to this would be a longer conversation, but the data was a real eye-opener for the municipal councils and the boards of directors of some of the involved organizations, and getting the communicating data about immigration attraction and retention, not only getting it but communicating it was a big thing in that project. It's a much longer story. Maybe go to my website, communityingenuity.ca, or look me up on LinkedIn and send me the question, and I can answer it in more detail. But I would say one of the big things that was an eye-opener in that project was the importance of looking at a functional community rather than a geographic community, so that the sometimes your functional community is a community of people that are brought together by common interest, or sometimes a catchment area that is a neighborhood or another type of community that doesn't really match municipal boundaries. And you need to think of the community that way. And then there are some data challenges with getting data that matches your community when you're not using standard Statistics Canada geographies. And there's some tips and techniques around that we use in the Big Data for Small Places program that may very well be transferable to your situation. Sorry, I think it needs a longer answer than that, and we don't really have time.
No, that's awesome. Thank you for sharing that. And so please, folks, get a hold of Nelson if you can, and he could certainly touch base with some other questions. There is another questions around what do small organizations what does a small organization do as it relates to data analysis of all the surveys and interviews that they collect over time? Is there any options or ideas on what they could do with all of that data that they're collecting? And that could be for anyone in the panel to jump in on.
Yes, certainly there's a module in the Big Data for Small Places program and in the workbook that deals with that to some extent. And in the workbook, there's also links to additional resources that people could follow up. We've used quite a few resources from the Aspen Institute on those kinds of questions, but certainly download the workbook, look through it. There's a module on that, some additional resources, and if you have more questions, contact me through my website or LinkedIn.
Awesome, thank you. So be yourself, see yourself, Gasol. I'm gonna use a play with that word because I love the title of it. And what we're going to ask folks to do is be yourself and see yourself in the next session, where we're going to be breaking you up into groups. And we want you to be yourselves and want you to think about some of the information that you've heard. And it's going to be a Jamboard, and we're going to be getting into the minds of everybody here to help us. And then we're going to go into a break because we've been sitting at the Zoom call for quite some time. So you could go to the bathroom, grab a coffee, say hi to the dog or cat or whatever it is, and come back to us after. So we're going to be breaking up into groups groups in this moment. You don't have to do anything. That's the best thing about Zoom. You will be automatically placed into those groups. And I want to thank all of our morning panelists. Thank you for all the time and presenting us and sharing with us this morning. So thank you, Nelson. Nelson and Saul and Ayom and Jennifer and all of you.
And I'm the data strategy manager at Ontario Nonprofit Network. For those of you who are just joining us now, welcome. For those of you who came back, thank you so much for coming back. Just a couple of quick reminders as we start the second session. So, if possible, please try to be in front of a computer. We really want to encourage some interaction and playing with the tools that we're going to introduce. Secondly, feel free to continue using the chat to flag us, ask questions, and or answer questions. And thirdly, as it's already been noted, we're continuing to record the session and it's going to be made available to all participants. So in just a few minutes, we're going to explore some data tools together. These tools can help us map nonprofit service delivery, support new collaborations and partnerships, and can help us access information about different populations and communities. So Marlon, I'm gonna hand it back to you to get us started.
Yay. I'm not sure if folks have realized as this has been progressing, I keep getting a little bit more excited and then my voice gets a little bit higher. So I'm hoping I'm coming across sounding like I'm composed. If I'm not, I'm just a little bit excited. Earlier, we heard around a few things around capacity building and opportunities to join some really amazing initiatives to help build the capacity of folks in regards to data collecting, data analysis, and so on. The next part of our work, we're going to be looking at data tools and making data work for you. And the first up are going to be two amazing people, Dave Montag and Laura Smith. Dave is the Director of Technology and Digital Solutions at Find Help 211 Central, and he's created a number of tools that help to utilize and share data across the 211 systems. And Laura Smith is the data analysis for Ontario 211 Services, and her work is primarily in building data reporting solutions such as Power B1 reports, which I know nothing about. And as you can see, the other theme of this presentation is that I'm continually learning. So please welcome Dave and Laura Smith. Thank you.
Hey everybody, it's actually Dave Montague, but you are not the first to make that mistake. So
sorry.
Yeah, no, that's okay. I should always phonetically spell. All right, so I'm just going to share my screen and hope that works. Everybody can see the red and white, I hope. Okay, so yeah, I'm Dave Montague, the Director of IT and Digital Solutions at Find Help 211 Central. And my goal today is to realize that I have too many windows open. Now, my goal today is to walk us through just a quick recap of the 211 data. Karen mentioned a few of those things at the beginning, but I'll just do a quick reminder. 211 being, of course, that 3-digit number where you can call and get referrals to social services. And because we generate so many calls, we generate a lot of data. And so what we've had to do is build tools, or wanted to do is build tools to help people access that data for ourselves, but also for other people, because there's so many different ways we can use it. So we'll do a quick overview. We'll do a quick tour of the many ways you can access that data. And then I'll hand it over to Laura. She'll do the Power BI public dashboard introduction. And this is why I will go quick, so that you'll actually have some hands-on time with that dashboard. All right, so just give me a second to catch myself here. So really what I wanted to do just quick is to go over the two different types of 211 data. And you'll hear this term a fair bit over the next few minutes, but it's resource data and needs data and how they are connected. How they're connected is probably the most important part to understand, because that's when if you want to work with this data, you really need to understand that connection. So the resource data is the service agency data. It's the stuff that most people know 211 for. Right, you go to 211 Ontario or 211 Central, you find resources that way. But behind the scenes, each service is tagged with taxonomy codes and other metadata descriptions and codes that help us find, organize, and share the data. And I gotta make sure, like I'm gonna spend a fair bit of time on the taxonomy. And by a fair bit, I mean about 30 seconds. The taxonomy we use, it's, I think Karen mentioned, it's the 211 LA taxonomy. And it's a taxonomy or a list of services or a list of terms of descriptions, and is over here in this corner as an example, of about 5,000 terms that we can choose from when doing data entry. And we can say this service is represented by this code. And it's so for example, if someone is asking for all the food banks in Toronto, we can go to the database, and instead of searching for food banks, the word, or food banks, the category, I can just go to this taxonomy code, and it's very precise. And I can pull out anything that's been coded with the BD 1800, 1200 taxonomy code. And regardless of name variations or individual sort of choices, the food bank is so precise that it'll just give me that list. And the reason I bring it up is because it also permeates the needs data. So now give me a second here. So where did I go? Yeah, right. So the needs data, and this is again what Laura will be talking about, so I won't go too deep into it. But the needs data is created when we make a referral. So each year at 211, there's hundreds of thousands of calls into 211, and we make referrals out to services. And we track the referral by the taxonomy code. So if we send somebody to a big organization like Costi that has 50 services, we don't just say we sent them to Costi. We say we sent them to the newcomer employment program. And that was done because it's been coded with that taxonomy term, newcomer employment service. So we're able to be very precise, and just maybe hard to read, but down in the corner here is just an example of some of the sort of the outputs. Because this is the data day, I felt fine or comfortable putting in charts and CSV screenshots. I hope that was okay for people. But that connection, when we say this was a newcomer employment service referral, that's the need record. And it's a taxonomy code that joins the resource and the need. So everything you see from sort of here on out will be that sort of that join when it comes to the data, especially when Laura starts talking. But again, the needs data is the what, the where, the when, the how, the who, that kind of information. So again, but I won't go too far because I know Laura's going to go very deep into that stuff. All right, so what follows? Again, this is a bit of a speed run through some of the data access tools that 211 has available. And again, our sort of mandate for the day was to try to, show people that it's great to learn about data, but if you want to access data, this is available to you. The 211 data set, is 50,000 records for the resources. The needs data, we've been collecting needs data from 2015 on in a format that we can share now. And it's hundreds of thousands of records. And it's a data set that the Power BI that Laura will show you is amazing, but it's also, there's the raw data behind, lets people work with it as to the way that they want to do so. But for the resource data, we have a tool that lets you export data in a sort of, with self-service platforms, is what I'm trying to say here. So we have a platform where people can log in with the right kind of permissions. They can do searches on the resources. They can, if you want to see, again, all those food banks in Toronto, you could go in here and search by a guided tour, or if you wanted to if you were more precise for some of the data analysts out there and how to use like the query language, you can do very sophisticated manual search queries. And then you just press submit, and then all of a sudden you got a CSV or an export file of the results. There's no back and forth. So these self-service tools, we want to get to a place at 211 where we have a suite of self-service tools, and we're getting there. And obviously what I'm showing you now is the beginnings of them. The other one on the screen here, this taxonomy one here with the red, this is a new tool. We had a request from a group that wanted to know what types of referrals were made alongside a housing referral. So if somebody called about housing, what else were we providing? And we realized that even the Power BI didn't have that option to do that. It was a more sophisticated sort of database requirement. So we built a tool that lets people put in any number of taxonomy terms, or just 1 or 10, and it'll give you all the records in our database that are related. And so yeah, so if we, and it's almost like, what was the action plan provided by 211, or what are the most common referrals when somebody's asking about this kind of need? And so this group in Niagara asked about this, like, we want to know what else is happening when people are calling about housing. And so with this tool, you can get that access. You can see all the other referrals. So it's an interesting way to sort of see, well, what is the common referral? Is there something missing? Is there some sort of area that we should be working through? For us, we've been thinking about using this potentially for onboarding and training, so that you can quickly see what is being done by others in similar situations. And we also certainly see it as an area for research. Like, the one group already has been able to do a lot with it in Niagara. So that's the taxonomy export tool and a resource tool. And again, the taxonomy tool as well, you filter by region, you can filter by date, all of that kind of stuff. So you can sort of see what's happening in the moment at your location. All right, so as I said, I'm going to speed run, definitely going to speed run through this one, but just wanted to make sure people know that we have a 211 services API or a resource API. People are able to, it takes capacity, as you can imagine. If this scares you on the screen, then it's maybe not for you, but the idea being that if you have technical capacity yourself or your team does, an API is a great way to bring in 211 resources to complement your services. We have groups that do, say, like a benefits finder tool. So they go through a needs assessment, and then it says, well, it looks like these are the things you need. And then again, based on taxonomy codes, they're able to bring back, because they mapped their categories to our taxonomy codes, they can bring back the related services that are close by. And they do that through the API. Right? They don't have to upload files or do any, and they certainly don't have to find that information themselves. They use the API to complement their existing service. Other people use the API to do everything. So they built a search all around the API. But again, it's not for everybody. The tool that is sort of the opposite of the API is the WordPress plugin. And that's more or less what we've done is create a plugin to connect and do all the technical work for the API. So you don't have to know how to code. This portal platform, or the WordPress plugin, is all drag and drop. You can customize the categories, customize the topics. And what we do is make sure, like, what we want to do is work with people that are creating sort of audience specific or location specific, not another province-wide general site, but more or less very much if you have a niche site or you've been collecting a directory on seniors in Brampton, you don't have to do that anymore. Like, that's what 211 data can provide. So what we want is to provide simple ways for people to get that information. So the portal, the WordPress plugin, is sort of the low tech way to do it. The API would be the high tech way to do it. And us sending you a CSV file, well, that's the lowest tech way, and the way we want to do the least, just so we know. I think we're close. So when I think about the data and the data tools, both the resources and the needs, as much as possible, have location attached. Certainly the resources do when it's a physical location. So you're able to map all the resources, of course. But we have the needs data. We aggregate up to certain levels, but we do capture postal codes as part of the referral process often, because that helps us find the closest service. But through aggregation, we can provide sort of bulk about what's happening in this postal code area or in this region. And what we've had to request to do is all the way from, like, say, something very, the North Ontario, what are the biggest needs in that large section, all the way down to, like, what are the needs in this 3-kilometer range around a school. And with both data sets, needs and resources, you can plot the map or plot the needs, and then you can also plot what services are there and do they match. And so we have people out there doing research on service gaps. So there you go. So I'm going to stop there and if you want to learn more about the data access, certainly there's a 211 Ontario page that has all the contact information about the data. And in fact, it's the page that Laura is now going to take you on a tour of. So yeah, that's, again, super quick, but the 211 data tools, the mandate of 211 is we want people using the data. So absolutely, if you have anything that you want to see there or learn more about, I would probably be your main contact. It's Dave Montague, but you can find us through the 211 Ontario site. All right, Laura, I'll pass it over to you.
Thanks, Dave. Okay, I'm just going to get my screen up and take over yours.
Yeah.
Okay, so I'm just going to be taking us through a fairly quick high-level overview of the public needs dashboard. Now, there's a couple of ways that you can get to it. The one is from our front page. You can click on 211 data, or in a moment, I'm going to be putting the direct link into the chat as well, so that people can go to this when we go to do the exercise in a moment. So on this page, you will see things like a little bit of a video that gives you some useful tips and tricks for using the dashboard, some information about the dashboard. And then down here, you'll see the dashboard itself. And at first, it's very small. You can actually get to it by clicking on here to bring it up to full size. And now Dave already talked a little bit about needs and about taxonomy. So this is where you start to see that. So it's very hierarchical in nature, and the taxonomy terms are mapped into these slightly more user-friendly categories that we refer to as the needs categories. So this dashboard primarily looks at needs and unmet needs for people who've contacted 211. You can see here the top 5 needs by needs category. In a moment, you'll be seeing how this is often the slowest to refresh whenever you filter the data, simply because it has to do another calculation in the background, as well as crawling hundreds of thousands of lines of data. There's this donut chart that gives you the needs, but you can also drill down into, which I'll show in a moment. You can change different date ranges. So for example, you can go into the calendar view and you could see particular months. You can also look across years. Although when you do that, a little caveat is that this will start to get very long. As you can see, we've got the month and the year here. You can also click on Show As Table. So if you want to see, if you've got something that is really hard to see in the visualizations, clicking on Show As Table will show you everything down here, as well as the visualization up on top. So for something like that, or the needs hierarchies, as I'm going to be showing in a moment, that can be extremely useful. You can see geographic information, and you can select geographic information by either clicking on this chart here, or by using the filters over on the left-hand side. Now, the filters over here allow you to select geographic and some demographic information and filter the entire data by that. And you can also combine. So you can combine geography with demographics, or you could take a look at different geographic areas. So say, for example, you want to take a look at Thunder Bay and Sudbury together. You can actually do that. And then you can remove ones by clicking on the X, or remove everything by clicking on the eraser. Or say, for example, you want to see, are there any differences in different age categories, the kinds of needs that they are presenting? So for example, if we take a look at child and youth, the top category for the entire province, when you're looking at all ages, is health. This will take a moment to refresh the one up here. But as you can also see down here, the top needs for children and youth, which the cutoff is age 24, by the way, are so far for 2022 are housing and mental health types of needs. Now, let's say you want to be able to report a little bit more granular than that. So for example, these are handy. They give you a very top level way of looking at it. You can drill down into any of these sections. There's 2 ways of doing it. I have a preferred way. You can click here to turn on the drill down, and then you can click on any section and start to drill through. The only caveat about doing it that way is you have to remember to turn it back off again before you select any of these sections.
Yeah, I'm just sitting here deciding whether I'm going to stay on this in this workshop or not.
I think we have people forgetting to mute again.
Yeah,
So,
and hopefully they will stay on. Thank you.
So the other way, and my preferred way, to be honest, is you can right click on any slice and then you can click on drill down. And there are as many as 5 levels that you can drill down into. So say, for example, health. You've got health supportive services. You might want to see more. Let's see health education. And now you start to get down really granularly to where you can see the request for vaccine information. Just going to bring that back. And I mentioned before, this is another area that it's extremely useful to see Show As Table. I'm just going to drill down one to show you what this looks like. If you start to use the drill down and then you do Show As Table, not only does it give you a table of everything at the level that you're at, but it also gives you basically a breadcrumb trail. So you can see if you're all the way down to 5 levels, it would show you the needs category level 2 all the way down through level 5. So it can kind of give you that context around where you're narrowing the data. And something else important to note just before I move on to our unmet needs page is that the data is automatically refreshed every 24 hours. This timestamp up here is the actual date that the data itself is current to. So the needs page is very similar to, the unmet needs page is very similar to the needs page, as in it has all the same functions, but you have an additional bit of information here, which is the reason why it was an unmet need. Now, we define unmet needs as we did not have an appropriate resource available to give to the person who contacted 211. And then we also capture the reason why that was. So for example, we might not have information about a program or service that would meet that need, or there might have been a barrier to service, such as there was a small cost for the service and the person contacting 211 could not afford it, or the hours of the program might have been restrictive. Now, Karen mentioned earlier on about service gaps, and this is where this page can become quite handy. Because an individual unmet need doesn't necessarily signify a service gap. It indicates that for that particular person, there was an unmet need. But as you start to take a look at patterns of unmet needs, you can start to analyze whether there might potentially be service gaps within a community. The other thing to note is there's a couple of ways of navigating this dashboard. The one is the menu over here. There are buttons that you can click on. There's also an overview button that you can click on, as well as some information about how to share. And you can also do what I'm doing, which is go to the arrows. So I'm going to jump to the front page here, and this is the page about contact reports. So for about 85% or more of the contacts that we receive, a contact report is generated. And a contact report is where we log information like the demographics, the needs, the referrals, etc. The reason why in some cases a contact report might not be generated is if something happens like there was minimal to no interaction, for example, prank call or hang up, etc. And this page shows you the total contact reports by month, as well as a comparison with total needs by month. You notice that this number is always a bit lower, and that is because an individual contact can generate more than one need. For example, somebody might call 211 and they might be inquiring about both shelter and food. And then you can also see some demographic information here as well as a bit of a breakdown about by days of the month. So with that, I'm going to move us into a little bit of a simple exercise. And I'm just going to pop the direct link into the chat. So this will take you directly to the page where you can go to play around with the data. And what I invite you to do is take a look at these two questions, just to start thinking about what are the differences between different geographic regions and what people are requesting. So I'd like you to take a look at the top needs category for Simcoe County for 2022 so far, and also the top needs category for the Niagara region for 2022 so far. And once you have that answer, just pop that into the chat, and as soon as we get enough, I'll confirm what the right answer is. Looks like we're already starting to get a few answers coming in. And also a little, I'm just going to flip back to this, a little trick on this. If you find the one that I said tends to operate a little bit slowly, is too slow, you can also look down here to get the answer. It looks like we've got a few coming through. Okay, I'll just wait a few more minutes for a few more people to pop the answer in, and then I will go ahead and reveal what it is. Okay, so we've got a fair few answers. Most of them agree. So the top need for Simcoe for 2022 so far is health, which is the same as provincial, but the top need so far for Niagara is housing. And I find that particularly interesting just because I live in Niagara and I know that every day in the news, there are constant articles about the housing crisis here. So it's interesting to see that that is also the top thing that people are contacting 211 about. Okay, so I believe next we're moving into questions for Dave or myself.
Do folks have any some questions for Laura or Dave before we move on to our next presenters?
I have a question. I'm Renu Minhas. The question is that this 211, is this the number that everyone calls in all regions, or different regions have different number and the information goes into 211?
Yeah, no, that's the number across Ontario. You can call 211.
Okay, so I just to give you an example here, I live in Mississauga, so we call 311. Is this the same thing?
No, and you would not be the first to think that. It's the 311 is the municipal services, right? So if you're the power's out or the, there's something wrong on the street. So yeah, 311's really just about the community social services.
Okay, thanks for the clarification.
Yeah.
Laura and Dave, you folks have generated quite a bit of questions on the chat. I'm just being wary of time. So what we're going to do is we're going to collect those questions for you and maybe send them back to you, and maybe you could answer them for folks. That would be super amazing. And sorry, I don't know why my video is off. Sorry about that. That would be super amazing if you could help us in answering those questions. And what I'm going to do is to continue on the presentation trend of having it be interactive and introduce to folks Stacey McDonald. I'm just being wary of time, folks. And Stacey is the Learning Evaluation Specialist at the Ontario Trillium Foundation, where she spent the past 11 years leading evaluation, research, and learning projects. So please welcome Stacey.
Hi, everyone. Thanks for the introduction. I am joining you today from the ancestral homelands of the Anishinaabe, Haudenosaunee, and the Attawandaron peoples. This is the Treaty 3, the Between the Lakes purchase land, what we call today Guelph. So thanks for joining. As Marlon said, I've been at OTF for a long time, working with the evaluation, measurement, business intelligence, learning team, and I work a lot with data. And one of the projects that I've worked on this past year is trying to see how we could get local data to our staff and volunteers to help inform them about, the communities that we serve. So I work for the Ontario Trillium Foundation, like I said, and so we provide granting to communities across Ontario. And we have tried over the years a few different projects in which we were trying to help connect our staff and volunteers with data. And in the past, we did that with reports on demographics and state of well-being in Ontario overall or specific regions. And what we heard from our staff and volunteers was that regional data didn't always resonate with their local realities. Two communities in the same region may have important differences that when the data got aggregated together, those stories were just lost. So we created these dashboards using census and community health, public health data to try to be able to look at more local data. It's a work in progress. There are some things that we know need to be improved. And it's also older data now. So we started this project last year knowing that 2016 census data was already a little bit out of date, but it's a test. We're hoping to continue this work as 2021 census data is released throughout this year, and accessing that data and trying to do a second version. And so right now we're figuring out how we can engage our staff and volunteers using this data, and hopefully thinking about creating something that could be useful not just to OTF internally, but to other organizations. So please share your ideas and feedback. I have a couple slides I'm going to go through before we go ahead and look at the dashboards. I'm just going to share my screen. Okay, so like I said, the purpose of this project was to better understand the communities where we work, the makeup of communities, and some of the strengths and challenges present. As we move forward, we hope that it helps us understand the changes that are happening in community over time. And right now we're using this to help orient new staff, hopefully soon orient new volunteers, help staff become familiar with new to them communities. Sometimes we have staff kind of helping out in communities where there's a lot of grant applications and they need support from other staff across the province. And to help inform information session planning. So which populations have a significant presence in a community and might benefit from targeted sessions. The data included in the dashboards are listed here and the sources. So like I said, 2016 census data, Public Health Ontario data, and Canadian Community Health Survey data. The health data is not available at a local level. And how we landed on this list is mainly looking at the data that we asked, or the information that we asked in our grant applications around the populations served. And so we tried to find, the best available data that was, I guess, comparable to those things that we were interested in looking at, as well as this sense of belonging that's listed further down as an important contributor to well-being. That is something that we wanted more context around how that sense of belonging is across the province. So things to keep in mind before we look at the dashboards, that this is data that we encourage our staff to look at along with their knowledge and experience, and it helps inform what we know, but it doesn't, tell a full story. There are a lot of kind of decisions around what data is collected and what isn't, and how it's collected and how it's analyzed. And so we always want to bring kind of a critical lens to looking at the data. Data gaps exist also. It's important to note that some census data is not collected for certain reserves, and some things like poor housing data or low income data is not collected on reserves as well. We use the best available data, knowing that it wasn't always a great fit for what we were trying to understand. Things like wanting to be able to look at a more local level at rates of people living with disabilities, but the data available at the local level was from a question around activity limitations. The data that we have around LGBTQ+ numbers, that question we know isn't entirely inclusive, and so doesn't give a full picture, but again, was the best data available to us. And things like ER visits for addictions, it doesn't give the full picture of whether there are community services supporting folks with addictions. And so some visits, the number of ER visits might be higher in some areas because of a lack of services, but that doesn't necessarily mean that there is a higher rate. It just may be that in other places, folks reach out to other services other than the ER when needed. And then data collection and the data available evolves over time. And so we will be making some changes. Things like gender identity will be collected, or was collected for the first time in the 2021 census. So this dashboard looks at sex at birth instead, because gender identity wasn't available. So I'm gonna stop sharing my slides and then start sharing the tool with you. Oh, sorry. Right, move that over. Okay. I just had some notes that I wanted to refer to. So the first page here is a welcome page. It lists all the different data available and which tab, there's different tabs at the top here that it's situated. It also lists a description of the filters and what they do. This is kind of like the basics of what you need to understand to navigate the dashboard. And then I just want to bring your attention to this variable definitions tab. So there's a lot of data, so it's a little slow to refresh sometimes. So this variable definitions tab lists the exact data for each measure and what it is with a link to the definition. So what source it's from, what was the question asked. Now we can look at the first tab is around like social identity data. And a lot of the navigation happens with these filters here. The default level of geography, because this was created, for our internal use, was the OTF catchment area. That's the areas in which we fund. But there are other levels of geography. So the region, so if you change the level of geography, you'll see the province now broken out into around 50 regions. If you want to go even more local, there's the city, town, township level, which there are hundreds of those, a lot to navigate. You can use then, when you get to that smaller level of geography, a region filter. So if you just want to focus on, let's say I was born in Sudbury, the greater Sudbury, it's a CMA. So the city, town, and townships, it just shows Sudbury and this First Nation reserve here. So then you can go down to the neighborhood level and it will show the census tract data. And so that's the different levels of geography. And maybe I'll just show a different one, Algoma. So for non-CMAs, the city, town, and township, Algoma here we can see, which you can kind of zoom in and out the map, drag it around. So the map here also has this search. So if you're looking for geography, instead of using the drop down, you can just type in a name there. But also you can change what's shown on the map by this variable. So if you choose, let's say, francophones, then the map will show values as counts. So this is where there's the greatest number of francophones. So Sainte Marie, you can see the number in the city there, or by percentages. So you can switch the percentage and you could see the percentage here. The highest one is 85%. Another way to really explore where there's higher or lower number of folks specific to a different identity is looking at these bubble charts on the right. And so each bubble is one geography. So if you want to see, in Algoma, where is there the highest level of Indigenous peoples? You can click on this bubble right here. It shows the rank number 1 and the percentage, and then it highlights it on the map here, Sagamok. And then you can see the details down here as well, with the counts, the percentages across this geography, the level of folks that are 0 to 9, all of them are Indigenous people here and the breakdown of those people by sex. And so that's some of the key features. Something else to note is this like little gray line here is a median. It shows the median, which is the middle point, you know, half the bubbles below or lower. And just to keep an eye on this, the scale changes. So instead of Algoma, if we were going to look at Cochrane, oh, it's the same. Let's look at Dufferin. Then instead of 100%, the scale changes to 10%. So to just keep an eye on that scale. Now the other pages of the dashboard are around lived experience. So there's things listed here: population low income, refugees, recent immigrants, activity limitations, and core housing need for renter households. It's a big mouthful, but it's the renters that have either unaffordable or inadequate housing. And then we have this community health. Again, it's only available at this one higher level of geography. It has information on ER visits, emergency department visits, sense of belonging, and mental health. So I'm going to put in the chat the link here. And I'm going to invite us all to open it up. Thank you, Marie, for sharing the what CMA is. Okay, so there's the link in the chat to the dashboard. I'm going to invite everyone to open it up and to take a look. And we can go to the identity page. Just going to clear that filter. And I'm going to invite us to look around a little bit. Interesting that 201 asked us to look at Niagara. I also was thinking to look at Niagara. So can we all focus in on Niagara region and to explore the differences between the different municipalities and cities in Niagara region? So to be able to do that, we want to stick on that like city, town, township level, but to filter for Niagara. And so by going to that city, town, township level and choosing region Niagara, then what that does is it focuses us in on just the different municipalities, townships in Niagara. And then the bubble charts won't be this list of hundreds that are really hard to make sense of and to compare, but we'll focus in on just these geographies in Niagara and what the differences are. So if we're looking here at the identity variables, sorry, something popped up there. If we look at the identity variables, just can someone take a look and let me know which area, which geography has the highest rate of francophones? Can someone add that to the chat? And for Toronto, the question about Toronto, you can drill down to the census tract level. So Toronto is a CMA. Excellent, Mel. Correct. Welland has the highest rate of francophones. Can someone tell me what that rate is? Sorry, while you're looking, I'm kind of jumping around here. Toronto, yes, you can look at census tract or all of Toronto. Great. Anne and Ted, yes, 10.6, awesome. Now, which area has the highest rate of Indigenous peoples and what is it? I'll just repeat that for folks in case I said it too quickly. Can we find the area in Niagara that has the greatest rate of Indigenous folks? So you can use the bubbles. Yes, the bubble here, Port Colborne, 5%. Awesome. And then just one last little question. If we want to go on the community health dashboard, which area in Ontario has the highest rate of a strong sense of belonging? And we can use the bubbles here, or we could look at the chart. So if I change this chart, the map to sense of belonging, very strong by percentage, you can see two are darker. Northwestern, good guess. The bubbles must be one on top of the other. You can see Northwestern is also high, but its rank there is number 2. If you just like move a scooch over, you could see Grey Bruce, Huron, Perth is ranked number 1, and the rate there. So that's it for me today. I don't know if there are any other questions or if I'm out of time. I forgot to look at the time when I started.
You did a fabulous job, Stacey. Do not worry. And we're hoping folks do have some questions in the chat, and we will send those questions to you. I'm just trying to be careful with the time for other presenters. Thank you for having us explore these tools. These tools that it's funny, I haven't used any of these tools in the way that folks have been presenting to us, and I thank you for that experience, because they're very helpful tools, and I can already see in the work that I do how we can, as an organization, use these tools. Next up for folks, we have a couple more folks who are going to be presenting, Danielle Lang, and then we're going to have Jesse Bournes. But first, Danielle Letang, and Danielle Letang is the data analyst with the Rural Ontario Institute. She's previously worked with both the federal and provincial government on projects related to natural resource management, knowledge mobilization, and sustainability reporting. So Danielle, will be bringing lots of creative information and experience to the topic for us today. So Danielle, please, thank you.
Thank you, Marlon. So I'll just share my screen. Yeah, so actually I am right now working as a data analyst with the Rural Ontario Institute. And so super happy to be here today. Thanks again to ONN and the organizing committee for having us today. It's great always to talk about data, so super happy to be here. So I have a few slides prepared for you today. I'm going to start off by giving you a bit of an introduction about ROI, who we are, what we do, our data products, and then we'll introduce the dashboard and then give a bit of demonstration. So the Rural Ontario Institute is a charitable not-for-profit. We work to build vision, voice, and leadership. And we do that by offering leadership programs, providing leaders with data and analysis, and connecting leaders to form communities of practice. ROI helps to inform leaders and rural communities through our knowledge products and our knowledge resources. So that's primarily through our focus on Rural Ontario fact sheets, which is the series that began in 2013 and continues on to this day. You can actually see a screenshot of what that might look like. The first page of one of our more recent fact sheets is there on the right. We also have a number of other data products as well, and a lot of links to knowledge resources. For example, the Big Data for Small Places workbook that Nelson had mentioned. So we do have a portion of our website that is dedicated to this, and it's called our Knowledge Center. And so it acts as a repository for our data products and resources. So in the screenshot below, this is from our fact sheet page. So the fact sheets are organized by year of publication, and they're available as downloadable PDFs. So the big question I'm sure people are asking is, why did we create a dashboard and why did we choose to do it now? So I'm sure most people here are familiar with the data problem. It's a big problem, a big data problem, if you will. Everyone needs data, and there's a lot of data out there, but it's complex, it's hard to gather, it takes a lot of time to analyze and interpret. And this is especially true for spatial data. A lot of data is not spatial. It can be, but mapping data is a very time-consuming process. And many rural communities and organizations just don't have capacity to take on that extra work. So, and our existing data products are really great, but many of them are not spatial and they're not interactive. So we explored various ways to try to help our stakeholders with all of these data problems. And what we decided to help do was create a data dashboard. And this is the first time that ROI has ever done anything like this before. But the whole point of it is to improve access to organized data that's already been processed to a certain extent. It will enable our users and stakeholders to interact with the data for their own custom unique needs. And again, we'll provide maps for some of that spatial context. So overall, we're hoping that this will help communities improve their understanding of rural data and regional trends. So we have created a new product, which is called Rural Ontario Facts. So this is a topical pairing of fact sheets with dashboards. So to the right is a screenshot of our website. So we have topical lists. And when you expand those topics, you get an option to click on the dashboard and then download the associated fact sheet. So we just have one dashboard for now, and the fact sheet is also forthcoming. So stay tuned for that. So the idea with this pairing is that the dashboards will provide all of the data. So the statistics, the maps, and other visualizations. And then you'll get the insight and analysis of that data and those facts through the fact sheets. And so they basically serve as the report. So our dashboards will be hosted on Tableau Public. The first dashboard in our series is focused on geographies. So I'll warn you now, it's mostly maps that you're going to be seeing. We don't have some of the fun visualizations yet that you've seen from some of the other presenters. But what we'll be showing on our maps is the rural and urban classifications that we did at different geographic scales. So we sourced our boundary data and our census data from Statistics Canada. And we're showing a limited amount of that data right now. Just the 2021 population data is currently shown, just for context right now when looking at the maps. So it's a bit limited right now, but our future dashboards will include a lot more of the census data and have a lot more visualizations. And so what we're hoping today is that the people that are here, that you'll connect with us about this dashboard. It's our first attempt, so we want to hear from you. We're seeking right now some feedback from beta testers over the next couple of weeks. And we're really hoping that you can help us improve this dashboard by giving us some feedback or reporting any problems that you might encounter when using this dashboard. And again, you can always contact us by email if you have general questions or just want some more information. So now we will go to the demonstration. Are you able to see that demonstration? Let me share this one. So hopefully now you're seeing the website.
Yes, we are.
Okay, great. So this is our brand new beta dashboard. So there's a few tabs along the top, and the first tab that you land on should be the overview tab, which explains a lot of information that I have already gone over. We also have included some links to data sources along the bottom. So these are all links to Statistics Canada's website. We also have embedded links for our website and our newsletter. And in the bottom corner here is how you can get in touch with us. So we have a short feedback survey, a reporting and issue survey, and then our general email to contact us there. So the next tab in the dashboard is all about how we did our urban and rural classification. So there's a lot of text here, and it's a little bit unusual to have this much text in a dashboard, but we thought it was really important to provide context for what people will be seeing in the maps on the other tabs. So this is just really quite a lengthy explanation for what we use for our approach, which is basically a Statistics Canada approach with a little bit of an adjustment. So if this is something that you're interested in, please do read it. We are interested in hearing feedback about our approach and obviously also about the dashboard. So getting now to the maps, the first map that we have is, and again, it's a little bit slow to load. They're quite complex maps, but this is a map of census subdivisions in Ontario. And what we're showing here is the urban and rural classification that we applied to each of the census subdivisions. And so there's a few ways that you can interact with this dashboard. You can click directly onto the map, which filters the table to the right. You can click directly on the table if you want to zoom in to an area. And then to clear the selections, you just click again. If you know which municipality or census subdivision that you're looking for, you can choose from the drop-down menu or just start typing and something will come up and then you can choose it. So choosing a selection from the drop-down or the table zooms the map into your selection. And then to clear it, you just click on this filter with the X, which is really tiny. And then there's one more way you can interact with this dashboard. You can actually select a census metropolitan area. So these are basically all of the urban areas in Ontario. So you can select them and then see which of the census subdivisions are associated with it. So for example, this is the Ottawa CMA, but you can see all of the other census subdivisions or municipalities that are part of the Ottawa CMA. So on the next tab, we have a bit of a regional classification. So this would be the census divisions. So the census divisions are just groupings of the smaller census subdivisions. So this navigation is a little bit more simple. So you have to click on a census division name from the table here. And when you do that, you will be zoomed in to the census division on the left. So you get the aggregated information for the census division, which is compared to the disaggregated information on the right for each of the individual census subdivisions. And then this table here filters so that it gives you only the ones that are selected. And to clear that selection, you just click again. You can also zoom into the maps, which I did accidentally here, but you could do it on purpose too. And if you wanted to reset it, you just have to click on the home button here. And then finally, we have a map of economic regions, which is a grouping of the census divisions. So this is basically the Statistics Canada, geographical hierarchy. We don't go down to the level of census tracts though. So again, here the navigation is the same as the census division tab. So just click on one of the economic region names in the table and you'll be zoomed in to the aggregated information on the left with the disaggregated information on the right. And you can see the different classifications in here. So that's it for the demonstration. Now for the exercise, we will go back to the PowerPoint. So I'm asking you to find the population or classification for some of the areas that I've listed here, if that's something that's of interest to you. Or there's an alternative activity where you could guess the population or the urban or rural classification for your community and then find the actual and just either share it in the chat or reflect to yourself of whether or not your guess was close to the actual or if you were surprised by your community's classification. So I'll give you a few minutes to start that. So we're asking for the first activity, if you can find the population or classification for Timmins, which is a census subdivision, the Thunder Bay Census Metropolitan Area, the Perth Census Division, or the London Economic Region. Or again, you can find the information for your own community too. So whichever you prefer. Oh, right, I have to share the link.
Thank you.
And there's the link. So you can access the link from our website, like I said, or once you have this link, you can access it directly from that link anytime.
And the link is in the chat, folks.
Yes. Oh, and something else I'll just note is that we are planning to do a more official launch of our dashboard product in a couple of weeks, probably before the end of the month, which is when we'll also release the fact sheet that's associated with this dashboard. Stacy, yes, you are correct. The population for Timmins is 41,145. Yes, and Rebecca, you're correct too. It is classified as rural. Yes. And just in case anyone is curious, the way we did our classification was basically any municipality that does not belong to a census metropolitan area was considered to be rural. So anything, non-CMA or even anything outside of a census agglomeration or belonging to a census agglomeration is also considered rural. So yes, Thunder Bay is considered urban, but the population of the entire census metropolitan area should be closer to 123,000. Yes, Jennifer, that answer for the Perth Census Division is correct. It is rural, and that is the correct population. So Emily, that's interesting. We didn't actually classify economic regions, but I guess according to our criteria, it probably would be considered urban, yes. Okay, Malin, I'm not sure how we're doing for time, but
Do you want to, you do have time to wrap up? I was just in the chat box saying how folks, and so thank you, Danielle, for another interactive presentation, because I could see through the chat, or I could read through the chat, the engagement, and folks are getting used to using this tool, which is awesome. To be able to get that hands-on experience with the various tools that we have here today. Danielle, I wanted to thank you for your presentation. There might be some questions that will come your way in the chat, and we'll share them with you. So thank you for sharing that. We have one more presenter, folks. Excuse me, Jesse Burns from Power by Data AJA, and Jesse Burns is the COO of AJA and a co-founder of Power by Data. He has deep expertise in technology and applying it to solve real-world business problems with a focus on the social sector and international development. And someday Jesse's going to give us some tools. Back to my parenting. I need some technology to help me with my parenting, and we'll talk about that offline. So please, folks, welcome Jesse Burns for their presentation. Thank you.
Hi, everyone. Thanks, Marlon. So I'm going to jump right into it because I know it seems like we're running a little bit over time, and I'm hungry. I don't know about the rest of you. So So what I'm going to show you today, it's been great watching all the other presenters, because they all have nice complete tools. I do not have a complete tool. I have an incomplete beta of a tool, but I'm still excited to show it to you. It's made worse because we were hoping to have a bunch of things finished for today, but our lead developer who was working on it was struck with COVID over the last week. So we still have some bugs, which we'll probably have forever. But anyway, so just some context, some background of what this thing is that I'm about to show you. So this deal strategy that ONN is leading, Aja and Powered by Data are both partners on it. There's a whole bunch of different activities that the strategy is focused on. And this component was trying to look at opportunities to develop shared infrastructure for getting and using information and data for the whole sector. And so we take that word really seriously. If any of you know us at all, and that word, by that word I mean infrastructure. So we are trying to find places where there's common kinds of information, common pieces of data or data sets that could be made accessible and put into the right formats so that they could be used for many other purposes. So we don't have an analytics dashboard. We don't have a tool like that. We have something that is meant to work with other applications and other research needs and other use cases, but is intended to solve sort of one small problem, but make that data available to a bunch of others. And the main thing that main data sets that we're focused on are things that tell us about what's going on in the sector, who is doing what, and attributes or information about those activities and about those organizations. So what we've done is we've gone looking for existing data sets that represent activities in the sector. We've combined all of those things, and those actually live in a repository, a GitHub repository online that is open and available to anybody. So if you know any software developers or any data scientists or any analysts that want to just access some raw data, all that stuff is available. And then on top of that, we built an example of what people could do with this data if it's made available to them. So we've made an interface, or we are making an interface, I should say, that lets you search through those organizations and those activities to find and segment them according to whatever your interests might be. And in the future, once this is complete, then it means that you'll be able to download that data for your own purposes, to do your own analysis, to even power some other tool that you might make for your website or for your networks or any kinds of projects. We're also really interested in how we can use some of the other information that's available about those activities to start figuring out kind of semi-automatic ways of classifying them so that you can try to segment stuff by more custom attributes or more custom needs without requiring everyone in the sector to have to go in and do data entry or tag a bunch of things, because there's a lot of data out there. So these are just some examples of some of the stuff that we imagine different organizations being able to use this for. And in building it, again, we had a very, very limited budget for this portion of that project. So this is intended to be a prototype and an experiment. But we spent a lot of effort, a lot of energy rather, speaking with a bunch of different organizations in the sector. We talked to people who are running programs directly and service delivery organizations. We talked to network and advocacy organizations by sort of focus and issue area. We talked to some different, it's hard to give a term to them, but beneficiary representatives or the groups that represent different communities, like the Foundation for Black Communities and the Circle. And we also talked with individual researchers and evaluators, just trying to determine what are the different possible applications of this, so that we, instead of just sort of building something and seeing what happened, we could try to focus on building things that would be helpful and useful for those organizations from the get-go. Which again, we're still very much pre-beta, even so we still have to find out after we finish this first iteration. But we're excited about what people will be able to start doing with it. So I just wanted to share, this is before we actually show you the interface, this is the mock-up of what it will eventually look like. And I should note that like it's a beta both in terms of its interface, so there's still some stuff that some features that need to be created, but it's also just the starting point for the data itself, because primarily right now we're using government data. So we've gone and found grants information that contains information about the projects and the activities that organizations are working on. But we've been working with different funder collaborative groups like EFC and others on trying to figure out how we can go start getting private foundation or public foundation data as well about their activities to slowly build out a more complete picture of what's going on in the sector. But just to explain this part, what you're seeing is lists of activities and organizations that correspond to some different keywords at the top, and that's the thing that any user can go and put in. And then on the left, there's towards the bottom, those custom terms, you can see that there's these filters that correspond to some specific organizations. And these are some of the organizations that we worked with in trying to develop the tool. And what we're imagining and what we've started doing with each of them is creating custom taxonomies, if you want, for each of their area, where they, instead of trying to figure out how to tag everything that relates to sustainability, for example, they'd instead be figuring out what's the set of criteria that would mean that something fits into sustainability, and that we would capture that and have that loaded into the tool. And if any of you have similar use cases where you'd like to be able to sort of break down different organizations in your issue area, and you could imagine using this for those purposes, please let us know, because we'd love to have more partners for that. And CIRIC has a similar need. They'd like to know about the different activities taking place across some different broad categories related to career development in their work. So we were going to give you an exercise today, and unfortunately, I think it's going to make more sense that I just give you a demo, both for time purposes, so I can pretend that I'm doing this as a favor to the organizers, but also just because, like I said, those bugs are a little tricky. So I'll probably walk through some of this and then answer any questions that you might have. But just to give you an example, and we'll send out the links as well afterwards for you to go and play around with the buggy broken version. But this is the home page, and now the share controls are in my way. There we go. Oh God, there we go. Okay. So this is very similar to the other mock-up, just again, not quite fully working the way we want it to, but up in here, you can put whatever we wanted. And I don't know, I'm gonna look in the chat to see if anyone's asked a question yet, because maybe that will tell me what examples to put. But for example, if you want to put in career, we'll go and see all of the organizations and all the activities that are going to correspond to that search. And again, right now it's very simple. We're going to be putting in more advanced search features like having logical operators. So you can say career, but not this, or water, but not water polo kind of thing. For each of these results, then we also have additional data that's available after you click through. And if we click in, you can see some of the stuff that exists. It's a bit of a mixed set of what actually exists and what doesn't, just because it's dependent on what information is available from the sources. But we have the opportunity to include a whole bunch of other things. So you can see that we've got the amount that they applied for, when the grant started, even going back to the source data itself. And in some cases where we actually have the organization linked directly using their business number or something like that, we can actually go see that as well. Again, it's dependent on what data is available. And you can, of course, search by multiple terms as well. So we have career that's in there. Oops, and I just got rid of one. There we go. But you could also look for leadership, and this probably will give me 0 results because it sounds like a strange name. Oh, no, there you go. But here we can see that there's actually others as well that are more specific and more precise. Again, adding more in logical operators, then I think we can say, show me all of the organizations that will match, or all the activities that match all these words, or show me only these ones that match, that kind of thing. But we're excited about building out some of that as well. So, like I said, unfortunately, it's probably not going to be a great experience to go and share out the quest, but I'm still going to put the link into the chat anyway, so that you can go try it out. If you find bugs, please feel free to share them. We have a form, a contact form that's live and on the website. If you have any feedback you'd like to give, or even if you'd like to let us know about some suggestions for a feature, or even just that you're interested in seeing what it would look like to apply this more specifically to your area, or building out a taxonomy, then yeah, get in touch because like I said, we're looking for more opportunities like that. In addition, the last thing I'll show you, this is the, and I closed it instead of opening it, there we go. This is the public roadmap that we have for this tool as we continue to develop it once our developers is healthy again. But if you're ever wondering what we're planning on doing next, or if you have an idea for a feature and are wondering if we have it in our roadmap already, you can actually go check it out. And I put the link in the chat to that as well. And we'll be updating this and keeping track of this in a transparent and public way as time goes on. And then I will also mention that on the About page is where you can learn more about what the data is, where it comes from, what the sources are if you want to just go straight to the sources. And like I said, if you know any nerds that just want to get access to the raw data itself, there's a link to the public GitHub repository that contains all of the actual data itself in CSV format. So that can just be downloaded and then used by anybody. So maybe I will leave it there. I know that was a very quick presentation, shorter than everyone else's, but just curious if anyone's got any questions. I see there's some stuff in the chat.
Let's see. Any questions for our good friend Jesse?
All right.
There might be some in the chat, and I was just going through the chat, Jesse, but my brain does not work as fast as computers or some of these tools that you folks have, so I'm not going to even try. But I wanted to say, a couple things. I believe I heard you say you were working with the Black Foundation of Canada, the new Foundation for Black Community. Is that right?
That's right. Yeah, they were one of the target. Not target, but the users that we were imagining could have a use for it, because that unfunded report that was produced, having a second version of that has more ways of trying to determine what kind of funding is going to these communities, and even looking across more of the data and experimenting with those methodologies. So that's what they imagined being able to use this data for, and that's what we're going to be working on with them. There we go.
Yeah. No, I am impressed with that, because my comment to that was, once again, we are folks here and others are finding spaces, well, to have impact and to strengthen the conversation and the arguments for more data and data that is available to folks, so that we can make really sound decisions and put resources where resources need to go. And it addresses a number of equity issues for a number of different equity-seeking groups that are out there. Sometimes data helps makes that compelling story, or creates that picture, or highlights an area or a gap that is missing. So I'm really impressed with you folks in joining that group of folks to make another create some space to make a stronger argument for resources, support, etc. What I would like to say to folks today, I want to first thank all the presenters. You folks are awesome. What you're doing is amazing. For folks like myself, who sometimes get scared of data and data tools, you got me excited, and that's pretty cool for me to say I got excited over data and data tools. Most folks would know that is probably not my strongest skill set, but you were able to make me feel comfortable and give me some insight into what are the possibilities. We're hoping folks on this call today have a stronger understanding of the value of data, how data can support the integration into operations and organizations. Hopefully, like myself, you've learned to increase some of your knowledge and skills through some of the practice sessions that we had today. And last but not least, I'm hoping for all the folks who are here and some who have left, that you have seen some links in the chats and created a whole new page on your computer screen to go back and check in with folks, network with folks, find out more intimate knowledge of what folks are doing and how that might relate to the work that we're all trying to do for the betterment of the province of Ontario. And last but not least, I want to thank ONN and for bringing us together, and Marie for bringing us together. I think there's many more conversations to be had. I am happy that it's housed with ONN because of the reach and stretch and the platform when we think about the nonprofit across the province of Ontario. So thank you for that. There has been a provincial election. 20% plus people have voted, not the vast amount of voters that we want. So we're not sure what the future holds for us as relates to some of the challenges in the province, what the approach of the government is going to be. But I know everyone here will be tackling on and holding our various levels of government accountable for the issues as it relates to data, data privacy, data collection, data sharing, etc. So I want to thank you folks. And I'm just going to ask Kathy to come in and kind of give us some few next steps in regards to all this information folks have had, and maybe to close it off. Sarah?
Thank you so much, Marlon. Wow. First of all, thank you for sticking with us. We know on a Friday, spending a few hours on data and on our screens is not ideal, especially at least in the Toronto area. It's a beautiful day out there. So I hope you can get outside after this. So thank you for sticking with us. And secondly, just know that this is actually just a start. Like I don't know about the rest of you, but I learned so much today, and also have been thinking about jotting some, like, how are we going to use these dashboards? How will this help a local community organization on the ground? So lots of questions about how we can move forward. So a couple of things. First of all, special thank yous. Wouldn't be possible to have today without our planning group, the Rural Ontario Institute, the City of Toronto, and 211 Ontario. So thank you for spending the time to plan today's event. Fantastic speakers and folks that are doing this work. So Karen and Sarah, Nelson, Haune, Kosa, Dave, Laura, Stacy, Danielle, Jesse, thank you all for spending your time with us this morning and sharing your knowledge and your tools and your slides. A very special thank you to Marlon, whose energy and enthusiasm for data it really keeps us motivated, and a wonderful moderator. And we really appreciate you taking the time today, Marlon. And of course, thank you to the funders of the Deal Strategy, the Trillium Foundation, the City of Toronto, Laidlaw, Jumpstart, and Lawson. Most importantly, a thank you to my colleagues Nimeri and John, and our comms team behind the scenes, Kavita and Rashid, who did so much to make today a possibility. And Nimeri is going to post her email in the chat because she is our manager for the data strategy and your key point of contact for ideas and questions and next steps as we go forward. But we promised that we would send the recording to you, all the slide decks and presentations. We are also going to keep the Jamboards open till 1:30 today if you want to add to them, as well as we'll share some high-level learnings from the Jamboards as well in a follow-up email next week. You can expect a feedback form as well. This was our first data day, and we really look forward to hearing your constructive feedback as we go forward. And there's lots of information about the Deal Strategy on our website and our resource center, including a new glossary introducing the sector to terms that may be of use to them around data. And I know John's going to pop those in the chat. So just a couple key takeaways from us really is that data is, data is a means to an end. There's storytelling. Data can tell a story. Data is most useful when it's tied to action. Those are some really important things to think about, especially as nonprofits and charities who have missions in our communities, whether we're art, sports, social services, to think about how data can help us do our work better, to tell a story and lead to action, whether that's policy change like ONN's focus, or whether that's changing how you're providing your services in your community. So that really struck me today, and I know we have lots more to think about and to address, but you'll hear from us soon. So I really hope you subscribe to our newsletter for the data strategy. We want to stay connected. We want to hear more stories about what nonprofits are doing, what questions you have, and we will certainly look forward to taking all this back to our steering committee to puzzle out what the next steps might look like. So thank you very much to everyone for your time today, and we really look forward to staying in touch. And stay safe and well, everybody.
Bye-bye, folks.